If you're somebody who likes to have a drink in the sun, actually your skin is more likely to
just really, really bad.
Is there a way that this could be done safely for the skin?
I have this conversation every single day with patients that have inflammatory skin conditions.
More than 70 of them being known carcinogens. More than 70.
Hello and welcome to the After Hours Skin Clinic. I'm Dr. Ellie Rashid.
And I'm Dr. Emma Craythorne. And today we're sticking to the theme of lifestyle matters for our next golden rule and talking about alcohol, cigarettes, sleep and exercise.
So in this episode, we're looking at how drinking, smoking, sleeping, or lack of, and exercise show up in your skin. We're talking inflammation and skin conditions, as well as long-term aging and wound healing when it comes to sleep.
We'll also be talking about how exercise can boost our skin health.
And of course, along the way, we'll bust some myths, share practical tips, and give you expert information on how lifestyle can really leave its mark on your skin.
So let's get started. We're going to start with alcohol. I think it's really good for you. It's not really good for you. It's really not good for you. It's really not good for your skin.
No, I mean, they always come out with studies that say, having a glass of wine might have some benefit for your health and for your skin. But I mean, ultimately, it is a carcinogen.
And ultimately, it is a poison.
Yes.
But let's talk about those studies where it shows it's good for you.
Let's just focus on that one study or two. I think the biggest impact that alcohol has is it really does disrupt your sleep. And when you're not getting good sleep, it definitely shows up on your skin. Double whammy. And you get so puffy after you've had a night of drinking. Mm-hmm. Just wake up so puffy and just look, ugh.
Well, alcohol is a vasodilator, isn't it? So meaning that our blood vessels become wider whenever we've been drinking alcohol. And usually that's the peripheral blood vessels. So that's probably partly why our face feels a bit puffier. We feel puffier in general, but also our face gets flushed a bit more easily. Visible blood vessels are a bit more prominent. And if we're somebody who has conditions like seborrheic dermatitis or rosacea or other inflammatory conditions like psoriasis and eczema, after a night of too much alcohol, which incidentally is more than 2 glasses of whatever you would normally have, then that tends to have a negative impact on the skin. And you see this increase in inflammation, which usually is either a bit of swelling or a bit of redness or a flare of an underlying condition.
And
it doesn't take much.
Dull. You just look dull. You wake up, and I'm not sure if it's the sleep or the alcohol, direct impact of the alcohol, but you just do not look radiant. The opposite of radiant.
So do you know that drinking alcohol in the sun is actually a double whammy hit? And
I mean, only because you've told me. But tell our lovely listeners.
So if you're somebody who likes to have a drink in the sun, actually your skin is more likely to burn as a consequence of that. And you're more likely to have an increased risk of developing skin cancers as a consequence of that exposure to the sun when you have been drinking alcohol. And the evidence for it is really, really very good, showing that that is the case. So that's a bit of a shame as well whenever we think about how impactful alcohol can be on the skin.
Outside daytime drinking is one of my favourite settings. Maybe I shouldn't say this on the podcast, but it really is.
So we know that alcohol isn't good for our skin, and by proxy, it's not good for the sleep that we would have thereafter, and it's not good for the flushing and redness and worsening of inflammatory skin conditions.
Yes.
And it's not good for skin cancer risk if you're in the sunshine.
And it's not good in terms of the sugar content. And so we know that with sugar, insulin release, insulin-like growth factor 1 stimulates the oil glands, so certain inflammatory conditions that are sebum related might be worse. And then also you might be putting on weight if you're drinking lots of alcohol because of that sugar content and all the calories that you're consuming. Again, not great. Metabolically active adipose tissue, which is pro-inflammatory, so that can make inflammatory skin conditions worse.
Yeah, so there's a lot of reasons why not to drink alcohol whenever it comes to the skin. I looked up, is there a way that this could be done safely for the skin? Ask it for a friend.
Did you find a small, tiny study? Let's just ask some marketing people. They'll figure it out.
Yeah, and the answer is obviously keeping it to one unit of alcohol, because more than that is typically whenever you start to then see these other effects that we talked about. So 1 unit, and not combining your week's worth all into one particular day. So I was like, so is that like having 1 unit of alcohol every single day? Because I think that could also be problematic. So in truth, the answer to this question is alcohol is bad. So it is good to be informed of the damage we're doing.
yeah.
Let's change our
It's
practice.
good to go into the damage with your eyes wide open.
Okay, so next.
Yeah, cigarettes.
Just really bad.
Genuinely, cigarettes just really, really bad.
So cigarettes is a definite no for the skin. I mean, there's so many reasons.
So many reasons.
I think I spend maybe, I don't know, 3 or 4 times a day having to have the conversation with somebody about why they have to stop smoking and the impact that might have for their skin. I mean, much less now than what it used to be like. You know, the standard question I think used to be not, do you smoke? I used to almost say, how much do you smoke? Because the standard response always used to be that people just always smoked. This was...
Do you also ask it that way because you can often tell who's a smoker and who's not?
Yeah, I was inadvertently saying that. Yeah, how much you smoke?
Yeah.
Yeah, and it's never 60 a day anymore. It's usually like 10 or something. But cigarettes and the skin, no, for a number of reasons. There's more than 7,000 chemicals in a cigarette, with more than 70 of them being known carcinogens. More than 70, and you're inhaling those into your lungs. And so that's having a huge oxidative stress response to the entire body. But also the smoke that's coming from the cigarette in itself is full of all of those pollutants that's immediately going onto the skin of the face. And that's also then having its own problems. So you're taking a collagen hit, and it's been shown that people who smoke, their skin is older than somebody who doesn't smoke. We know that in surgery of the skin that your wound healing is massively impacted, and you've got an increased risk of things like infections and therefore poor scars and poor wound healings as a consequence of that. And actually in your world of inflammatory dermatoses, cigarettes make those conditions worse.
Yeah, for sure. 2 modifiable risk factors for hidradenitis suppurativa, the inflammatory skin condition where people get boils, abscesses, and these draining tunnels in their armpits, groin, around the bottom area, smoking and obesity. And I'm not saying that if you were to stop smoking and you were to lose weight and be within a healthy body mass index, that those conditions would go away, but it's all about ramping it up or ramping it down. So if you could eliminate smoking, I have this conversation every single day with patients that have inflammatory skin conditions.
Yeah, as hard as or difficult it may be to not smoke, smoking is a
Number
problem
one
for the skin.
issue. Yeah.
After the sun causing damage to the skin, it's smoking's next. And multiple studies show that.
Yeah.
So having a good night's sleep has an impact on the skin.
Yes.
There was a little study in the BMJ showing if you have a poor night's sleep or you don't get your beauty sleep, that you can see this. And they did a study with photographs and looking at people who had a bad night's sleep, and they were rated as to how old people thought that they were, and they were all rated older than they were after they'd had a bad night's sleep. So you can see that. And that was just one bad night's sleep.
My gosh.
Can't see it in you.
Really?
Yeah, you must be sleeping gorgeously every night.
God, horrifically.
But when we think about the kind of rhythm of the different hormones that happen overnight, you know, melatonin's released, this really super powerful antioxidant. We've got all of our repair processes happening overnight. It really is very important for our skin and our radiance and our skin health.
It's good for our mental health as well, just having a good night's sleep. Just wake up more alert, more focused, less brain fog.
Yeah, so just sleep. Done. Okay, I've got some really good studies on exercise I've found here. So obviously exercise is good for our skin. You'll like this. There's this study in terms of mind-body kind of wellness exercises in patients who have psoriasis. So it shows accelerated psoriasis clearance in patients who were put on an intended mind-body program. So they did a kind of, well, I think it was yoga that they did in the study. I can't really quite remember. But you get improved psoriasis clearance.
Oh, nice. You know, there's also that like virtual reality where they've looked at improving people's mental health by, it's almost like this simulated reality where you're in a really relaxing place. Like imagine like on a beach or in a forest or something, like a really relaxing place. And they've looked at, there's a study to look at people's inflammatory skin conditions, and things got better and people were able to lose more weight when their mental health was better and their cortisol levels were reduced.
Yeah.
I love stuff like that.
Yeah, so I think that that's really important when we're thinking about our perfect day for our skin, is to make sure that we've got all of that incorporated in our stress and wellness levels. And there was also a study that was done in humans that looked at resistance training in women in the kind of middle age of their lives. It was a human trial, and it showed that resistance training programs increased dermal thickness and elasticity. So for those women who engaged in that. Now, obviously, there's lots of confounders that can happen there, but that's interesting.
Any lifestyle study, there's always going to be confounders, but I think ultimately sounds like a good thing to do. So to wrap things up, we're telling people to never start smoking. If you're already smoking, stop smoking. If you're drinking alcohol, think about reducing your alcohol or cutting it out altogether.
And maybe not in direct sunlight.
Don't drink alcohol in direct sunlight. Go in the shade. Try and get a good night's sleep. It really does have benefits for your skin and mental health. And try and just move your body.
Yeah, move your body. Resistance training.
Yeah, move your body and do resistance.
Come to Reformer Pilates with me.